Thank you very much, Mr. President. I'd ask unanimous consent that Scott Litzelman, a legislative fellow in my office, be given floor privileges for the remainder of the Congress.
Without objection.
Mr. President, often late at night, when the Senate passes by unanimous consent a piece of legislation, people often don't get a chance to understand what it really means. And usually there's a sense, well, this maybe won't be the most important thing coming down the road, and everybody just said okay, and so it passed the Senate. Last night, the Senate took action on Medicare. Medicare at a time when 10,000 people are turning 65 every day for years and years to come is something that millions of older people rely on. And their kids and their grandkids make plans to make sure that their grandparents are taken care of, but also they want to know what their future is going to be all about. And what the Senate did last night, Democrats and Republicans coming together, is, in my view, transformational for seniors today, and the beginning of an effort that is going to evolve in the days ahead for kids and their parents and their grandparents to, in effect, benefit from an updated Medicare guarantee that will stand the test of time for many years to come. And the reason why I say updated Medicare guarantee, Mr. President, is for me, and I know millions of others, and this goes back to the days when I was director of the Oregon Gray Panthers, the senior citizens group. Medicare is not a voucher. It's not a piece of paper. It's not something you get and, well, maybe it'll do you some good, but if your health costs go above your voucher, you're going to get buried in costs. Medicare is a guarantee that vital services are going to be available to those over 65. And last night, the Senate, all senators voted to send to the House of Representatives a bipartisan effort that was years in the making to update the Medicare guarantee to start focusing on chronic illnesses like cancer and diabetes and heart disease and Alzheimer's. And Mr. President, I'm going to make this a little bit personal. I'm so grateful to Chairman Hatch and Senator Isaacson and Senator Warner, the bipartisan group in the Senate that have been working on this. What I can tell the Senate tonight and colleagues is back when I was director of the Gray Panthers and ran the legal aid services for older people, Medicare was a very different program. Back in the 1970s, when we were getting the Gray Panthers off the ground, it's a very different program than it is in 2017. Medicare really consisted of two parts. There was Part A, and that was if a senior broke their ankle or needed surgery for a broken hip, they went to the hospital, and there was Medicare Part A to be there to cover a senior's surgery. If a senior had a really awful bout of the flu, he or she visited the doctor, and they used Part B. Mr. President, that is not Medicare in 2017. Medicare in 2017 is not primarily about treating the flu or a broken ankle. It's there for those conditions, and we're very glad that it is. But more than 90% of the Medicare dollar goes to treat older people with 2 or more chronic conditions. And I will tell you, Mr. President, until the Senate Finance Committee on a bipartisan basis began to deal with this problem. And fortunately, we had a couple of colleagues in the House who picked up on it as well. My sense is basically both political parties had missed it. They really missed the fact that most of the Medicare dollar, 90%, goes to seniors who have 2 or more of these chronic conditions. They might, for example, have dealt with diabetes and heart problems. But today's seniors really face the kind of conditions that didn't dominate the program back in the days when the Gray Panthers were getting off the ground. Now, today, seniors get their care in a variety of different ways. It's not just fee-for-service, medicine. We have the Medicare Advantage program, accountable care organizations, other new systems under development. And so keeping up with those changes, updating the Medicare guarantee ought to be a real priority for policymakers, and that's why the Finance Committee has put so much effort over several years to get the bill that passed late last night across the finish line. There are still more steps before the policies reach the President's desk, but with strong bipartisan backing of the entire Senate, I'm confident the job will get done. The Chronic Care Act means more care at home and less in institutions. It will expand the use of life-saving technology. It places a stronger focus on primary care. It gives older people, however they get their Medicare, more tools and options to receive care specifically targeted to address chronic illnesses and keep them healthy. These, in my view, are a whole set of building blocks that you have to set in place to update the Medicare guarantee. Still to come is ensuring that every older person with multiple chronic conditions has an advocate to help them navigate through the Byzantine healthcare system in America. And Mr. President, I just want to highlight that point. If you have 2 or more of these chronic conditions, I guess the physicians call them comorbidities, you can be drowning, especially if you're not part of a coordinated care program or Medicare Advantage or something like that. You can just be drowning in forms and processes and procedures. And lots of times over the years, I've gotten calls from a child who's a lawyer or an engineer, and they've said, Ron, help me out trying to get through all this maze of bureaucracy to try to get help for my parents. So I want it understood that what the Senate has done as of last night is an extraordinarily important beginning, but there is a lot more to do. I want to wrap up my comments on this subject and then turn briefly to one other, Mr. President, by handing out some very appropriate thank yous. I think the Finance Committee has handled this bill, in my view, as a model to work on a bipartisan basis. I want to thank Chairman Hatch. He and I put together the Bipartisan Chronic Working Group 2 years ago, and Senators Warner and Isaacson did a first-rate job of leading it. There was an awful lot of sweat equity put in by staff. I hope I don't mangle too many of these pronunciations, but a lot of staff worked on these issues while they were dealing with weddings, and I guess we had 3 children born in the process, and job changes. So big thanks to Karen Fisher, Hannah Hawkins, Kelsey Avery, Leigh Stuckert, Liz Jurenka, Beth Vrabel, and Matt Kazin on our team. Chairman Hatch and his team really stepped up to work with us and all the senators, Jay Kosla, Brett Baker, Jen Koskowski, Katie Meyer-Simeon, and the chronic care lead, Aaron Dempsey. And big thanks also to Senators Warner and Isaacson for lending us, and I hope I don't mess these pronunciations up too much, Mr. President, Marvin Figueroa and Jordan Bartolomeo. And Mr. President, I just close this portion of my remarks by saying that I think what happened last night, while certainly not something everybody is talking about this evening, is something that is going to be extraordinarily important in the years ahead, and on an issue that I know the President of the Senate and I have talked about, this whole question of health care and Medicare and the like. This was an important step to take and an important step we can build on, and I hope the other body, the House, will take action quickly. Mr. President, let me turn now to this question of the Puerto Rico disaster. It has now been a week since Hurricane Maria made landfall in Puerto Rico, and 3.5 million American citizens are living amidst a horrifying state of devastation. When I was chairman of the Energy and Natural Resources Committee, which has jurisdiction over the affairs of Puerto Rico, the U.S. Virgin Islands, and America's other territorial possessions, I got very involved in the economic issues on the island. So I come today to make a humanitarian plea to my friends and colleagues in the Senate. And it's a plea really not about economics, it's about people. Fathers and mothers, children and grandparents, teachers, nurses, thousands of veterans who serve their communities and their country proudly are dealing with something that is almost unimaginable, this horrifying set of circumstances that they are now finding dominating their life. The press accounts describe Puerto Rico as looking like a war zone. Millions of people on the island are without power, running water and fuel. The few hospitals that are open, only 20 for the entire island, struggle to care for the injured and the sick. Many doctors and first responders are unable to get to their workplaces because their lives, too, are thrown into chaos. 911 still doesn't work. Cell service and power are down. The airport in San Juan barely functions now after days of being completely off the grid. It is almost impossible for us here in this city to imagine this. The basic infrastructure of health and safety that we take for granted every day. Only one word sums it up: totally demolished. Demolished. It's almost impossible to gauge the full extent of the devastation. Nobody knows how many lives have been lost, how many homes and businesses have been damaged beyond repair, how many lives shattered. What is known as this storm, this disaster, has affected the lives of every single one of the 3.5 million individuals living on the island and the millions more on the mainland U.S. who have had sleepless nights worrying about loved ones. This is a humanitarian crisis on American soil. It is past time to step up and provide immediate aid to help these Americans, not only for Puerto Rico, but also from the U.S. Virgin Islands that has also been clobbered by these storms. It's not just the right thing to do, it's the only thing to do. A few hours ago, I joined 35 of my colleagues in sending a letter to the President, and we requested a number of concrete actions. And there are other additional steps, in my view, that are vital. So I want to just tick through some of them on the floor. First, the President has to issue a full disaster declaration for all of Puerto Rico, not just parts of it. Currently, 24 municipalities in Puerto Rico have yet to receive individual disaster assistance. This means that people who've lost their homes in these areas are ineligible for federal assistance. This is unacceptable. Next, while the President rightfully revised his original disaster declaration so the island will not have to split the cost of disaster relief with the federal government for 180 days, the President should continue this assistance until the island is back on its feet. The administration also needs to include funding and necessary emergency support for the Puerto Rico Medicaid program in any emergency request. Medicaid in Puerto Rico doesn't work the way it does in the 50 states. where it's a guarantee of care for vulnerable, low-income people. Puerto Rico's Medicaid program is built on a block grant, which means that in times of crisis, resources might not be there when it's needed most. Even before the disasters, Puerto Rico was close to depleting its Medicaid supplemental funding. When it does, it will have nowhere to turn to pay for medical care for many of its most vulnerable. In my view, this is a perfect example of why block grants is contemplated by the bill that we considered in the Finance Committee this week. Graham Cassidy, Heller, and vital programs like Medicaid don't mix. It is a recipe for trouble. In addition, Mr. President, there are expired tax provisions that are unique and vital to Puerto Rico's economy, and they ought to be extended with any disaster relief package in order to give workers and businesses certainty and predictability. This includes tax incentives for producing goods in Puerto Rico and rebates for taxes on exported rum. In my view, this, if done properly, laid out in a proactive way, will give predictability for the future and make a difference, an important difference to a lot of people on the job. It is also vital to get Puerto Rico's electric grid up and running and provide power generators in the meantime. This isn't simply a matter of recharging phones or turning TVs back on for news updates. Going without power is life-threatening. Perishable food goes bad. Those with diabetes can't refrigerate their insulin. Hospitals have a difficult time running essential medical equipment like dialysis machines or heart monitors. Air conditioners are useless, especially dangerous for kids and seniors, given the hot, humid temperatures and the limited supplies of safe water. Another necessary step is to help ensure Puerto Rico and the U.S. Virgin Islands receive assistance as quickly as possible, and that would include a short-term waiver of the Jones Act. The Jones Act is an important policy for ensuring a vibrant U.S. maritime industry and for our national defense. The government has granted such a waiver in Houston and Florida, and it is, in my view, beyond comprehension that they haven't done the same thing for Puerto Rico and the Virgin Islands. Finally, the administration needs to mount a full-court press to rebuild the island's roads and ports and airports. Once the aid arrives, it's useless if you can't get it out to those who need it most. As several of my colleagues and I wrote to the President today, our military is uniquely qualified to help Puerto Rico meet some of its critical recovery needs. That includes construction battalions that can repair power and surface transportation infrastructure. Mr. President, I close by saying the people of Puerto Rico and the Virgin Islands are desperate for our help. The situation is extreme. Congress and the administration need to act as soon as possible. The cleanup from Maria and Irma is just the beginning. And the fact is, these megastorms fueled by global warming are going to keep coming. Even after the power is restored and the storm damage from Maria and Irma is repaired, there's going to be a lot of work necessary to reverse years of struggle and build up Puerto Rico's economy and infrastructure. Coming to the aid of our fellow Americans at a time of crisis, in my view, is at the very core of being Americans. At home, I call it the Oregon way. Our natural disaster this summer was wildfires. So recently I was out visiting fire camps that stretched from our northern border with Washington State to our southern border with California and many points in between. I met people, Mr. President, helping Oregon fight fire from all over the United States. I met Floridians who were there the weekend Irma hit Florida. They were there to help Oregonians deal with fire when they and their families were worried about what Irma was going to do to Florida. Colleagues, I close simply by way of saying we should expect no less in our efforts here in the Senate to help our fellow Americans in Puerto Rico and the U.S. Virgin Islands. The American people have to now be part of a mobilization to bring together the enormous resources of the federal government to help when disaster strikes. It is a matter of basic fairness and humanity to help protect and restore these American citizens and lands. Mr. President, I yield the floor. And I thank my colleague as well from Oklahoma for his courtesy.